Since I was a kid, I had hip problems, just always a pain. And when I was 16, I had my first hip surgery, and I had it arthroscopically done, which in the mid 80s, was not very common. So they flew someone in from California to do it, and it did wonders for me. But yet the problem was still there. In my mid 30s, I went and had it done again and cleaned up. And then that lasted a little bit, and then I just knew it was time that I needed to, look at getting my hip replaced. I found Dr. Antonacci, and he was telling me about his new procedure of the anterior approach. And I was really excited because the recovery time and a lot less damage to the muscle was where I wanted to be. I wanted to be more mobile. I'd seen how my parents, they had their hips replaced and knew that it was a long road. So it was exciting for me to see this shorter road, better, recovery, quicker downtime, and had my right hip done 2 years ago, and then knew my left one was bad too. And when that one got bad after a couple of years, I didn't even think twice about it. What I knew was bad is when you're constantly thinking you're in pain, and you're constantly thinking, how am I going to get myself out of this pain? So whether you're sitting more or you're taking more ibuprofen to try and alleviate, just to function through the day, or when I have to tie my shoes and knowing, oh my gosh, here we go, or bend over and pick something up. That's, when that became difficult and was constantly giving me pain, riding in the car for a long time, and getting out, constantly giving me pain, I knew it was time that I needed to look at getting it done. My bounce back was really quick. I think I was in the hospital for a day and a half, and back at work in 2 weeks. So, and then, I used a cane for maybe, a couple days, walker for 1 or 2, just to make sure my balance was there. But the recovery was just great, and then I'm only being out of work for a couple weeks made it that's much better. I have 3 kids, and I love to be active with them. I love to do things with them, and it was taking me away from being able to do that as much. Going out and playing in the snow, running around the backyard, just being an everyday dad, playing basketball in the driveway. I couldn't do that. It was just too painful to do that. Didn't feel the need to get back into basketball or to running 5Ks. I just want to be an everyday dad and having fun and not in pain when I do those things. And now I don't even think twice. I just get up and go and do whatever. And it's so much easier and life-giving to do it, where it's not taking away from my life, it's just making it better.